Welcome to another episode of What the Health. I'm Janelle Thompson, family nurse practitioner at your Hawkeye Student Health Clinic. Today we're going to talk about headaches. I'd like to start today with tension headaches, and then next week we'll talk specifically about migraine headaches. Tension headaches are a common problem, and certainly for you college students busy here around campus. Tension headaches are often located on both sides of the head, and they tend to have a band-like and constricting type quality to the pain. They can wax and wane throughout the day as to how painful they are. You will notice that with a tension headache that you might have discomfort if you would move like the muscles of your eyebrows, if you would feel the muscles in your neck, your shoulders, or even just shrugging your shoulders, that you might have tension and even feel some relief when you do that. Tension headaches generally are bothersome, but they don't really limit your activities during the day or your lifestyle. They're more of an annoyance. So what are the treatment for tension headaches? Well, we think first about the underlying cause. So these can be caused by stress, and so if that's the problem, you can look at trying to remove stressors. It could be posture, so things that would cause additional lactic acid buildup in these areas. Could be a change in activity. Maybe you slept in a different pillow, or you took a vacation and slept in a different bed, or you changed your workout. So when we go to treat those areas, then we think about what can we do to fix that. So activities that would just gently stretch those muscles, squeezing activities to help get the lactic acid out, massage, and for people who have routine or more common tension headaches, even physical therapy can be beneficial. As for medications, they're not necessarily needed, but if it is something that's so bothersome that medicine's needed, then the first line treatments are generally the non-steroidal anti-inflammatory medications, which would be such as your ibuprofen or your over-the-counter naproxen or naproxen. But if you can't tolerate that kind of medicine, because they can be hard on the stomach and some people do have allergies, then working with acetaminophen, which the brand name would be like Tylenol. Generally, anything stronger than that really isn't necessary. If you need to use medication for your tension headaches, I want to caution you not to be taking medication routinely. You can actually cause a syndrome called medication overuse headache syndrome. And this is where your body's pain receptors get fooled a little bit, and you actually start to continue to have headaches because your pain receptors aren't understanding what the medication is supposed to do. That's a very simplified version of that, but it's more common with stronger medications used for different types of headaches, but it can happen with ibuprofen and with Tylenol also. So point being, if you're having tension headaches or any type of headache where you're needing to take medication often and frequently, come and see me and let's talk about it and let's see what's going on. Thank you for joining me for another episode of What the Health. I will see you next week where we'll talk about migraine headaches.